Hey out there, this is Andy Stansfield. I'm a licensed health and life insurance agent with Stansfield Health and Life, and I work with all types of people, specifically on their health insurance. A large group of people I work with out there are in the age groups of 55 and up, people that are generally considering things like Social Security, retirement, what to do with Medicare, and things from there. But another big thing they always think about is their current health condition. So I have with me today a very good friend of mine, Michelle Scott. She is an advanced practicing registered nurse with Ready Health and Wellness. This is her own clinic that she has here in Jacksonville, Florida. And she provides primary care services to the underinsured and even uninsured folks here in the Jacksonville area. So I wanted to welcome Michelle. Thanks for joining me today.
Thank you for having me.
Sure. Can you let us know a little bit more about your background and everything here in Jacksonville?
Yes, Andy, I've been a registered nurse for 29 years now, and my background was in the hospital working in the ICU, and I did that for many, many years. And then I decided to advance my education and become a family nurse practitioner. I'm board certified, and I've been practicing now for 12 years. And I was really passionate about healthcare for all. And it appears in our society that people who are uninsured don't have proper access to healthcare because of financial barriers. So I created Ready Health and Wellness to provide a means for the uninsured to get affordable healthcare. We are a cash practice, and we have discount visits, we have discounted labs, we have discounted imaging as we partner with business associates that provide those features for us. And we're just, really excited about providing this service to the Jacksonville community.
That is terrific. I know with my experience helping people with health insurance, I do come across a lot of people that are for whatever reason, a number of different reasons, uninsured or just maybe underinsured. And I know you've been an excellent resource for people like that, and not just individuals. There are a lot of companies out there that don't offer health insurance at the moment, and so a lot of their employees are underinsured, and you just offer some really, really great services for people in that type of situation. So we're first talking about getting together and chatting here. I was trying to think about what are some subjects that might appeal to the groups of people that are likely watching the channel here with Stansfield Health and Life. And first thought was, well, we could talk about, all the preventative services out there, the different screenings you're supposed to look for and all that. But you had a really important thing to tell me after that. And that was the fact that, when we're talking about this group of people, sometimes the preventative screenings is a little bit, too little too late. Basically, the screenings, the conditions that these screenings are going for are conditions that these people already have. So I thought maybe a little bit more importantly today would be just to go over some basic tips and basic advice that you as a healthcare provider would give anybody in this situation, realistic things that they should or they could be doing to kind of better their health when it comes to kind of I call them the four big conditions there. And I'll kind of go over those before we get into these tips. And this came directly from you, the kind of the main conditions that you typically see when it comes to this age group. One would be what's something called hyperlipidemia, but for those out there, that's high cholesterol. There's hypertension, which is also known as high blood pressure. There's, of course, cancer is a really big one out there. Diabetes type 2, another really, really big one that I'm sure you see. I see it with a lot of people I work with as well. So rather than talk about the preventative screenings you can do to discover these conditions, let's talk more about, you've been diagnosed with these things. Now it's time to work on that and see what can we do to fix that situation. So I came up with kind of 5 real basic things, and I was going to kind of throw them at you to hear a little bit more about them. And I'll start with number 1. Number 1 being take your medications as prescribed. Seems simple and all that, but I'm sure you've dealt with situations that may not be the case. So I wanted to run that by you.
That's correct, Andy. Take your medication as prescribed is so very important. And what we see often in healthcare is if a medication is prescribed for an individual for one of these conditions, once that person starts to improve or feel better, or their blood pressure has returned back to normal, or their cholesterol readings are back into normal range, we see sometimes that these individuals will stop taking the medication and they feel like, I don't need it anymore. My blood pressure is normal. My cholesterol's in check. My blood sugar is within normal range. I don't need to take the medication anymore. But what we need to stress today is it's because of the medication that your blood pressure is normal, or your cholesterol's back where it should be, or your blood sugar is okay. The medication lowered it, got it where it should be, and then you must continue to take the medication to keep it there. Because once you stop taking the medication, then those conditions come back, those elevated readings return. And when your cholesterol is high, or your blood sugar is high, or your blood pressure is high, there's damage being done to your blood vessels and to your target organs in your body. And even though you may not feel ill or, feel bad, this damage is occurring. And so the goal for the medication is to prevent target organ damage. That's your kidneys, that's your heart, that's your liver, that's, your vital organs that depend on normal blood pressures and depend on unclogged arteries to function properly. So it's very important to continue your medication until your healthcare provider discontinues it.
Yeah, makes sense. I know they don't call them chronic conditions for nothing. These are
That's
long-standing, long-running conditions. So yeah, obviously it seems like simple advice, but obviously run into lots of situations where people will just decide upon themselves rather than working with a trusted provider there. Second is, and this sounded like kind of the not fun part to me, was limiting a bunch of stuff, taking a lot of different things out of your diet, things like sodium, simple sugars, fried, greasy foods, smoking, and alcohol. Those are kind of big fun groups right there, but obviously very, very important if you're trying to maintain or even reverse some of the effects of these conditions.
That's correct. So it's really important if you have hypertension, limit the salty foods. Potato chips are high in salt. What some people don't realize is diet drinks, or not just diet drinks, but sodas, processed lemonades that you get from the convenience store or from the grocery store. These processed drinks are high in sodium. So when we say limit your sodium, we're speaking of typically 2 grams of sodium a day. And if you start reading labels, you'd really be surprised how much sodium are in some items, like the sodas, high in sodium, very high in sodium. Lemonade, high in sodium. Not dismissing added sodium that most people add to their meals also. You gotta limit that. And then you have to be mindful of how much sodium you use when you're actually cooking your food. So there's so many things to look at and to reduce when you're going to reduce your sodium intake. So the first thing I recommend is start reading labels, and then whatever the normal amount of sodium that you normally use to season your food when you're cooking, cut that in half.
Yeah,
cut that in half.
Yeah, my wife says all the time, she's looking at the labels on packaged foods in general. And I mean, think about it, kind of two ways that I would see that. One is sodium is a great way to preserve things. So the reason your potato chips last as long as they do, and on the shelf and in your pantry is that sodium. And the other part is, food companies, food producers out there want to sell more products, and guess what works? Sodium. One of the big things in there is just a big trigger for people is the saltiness there. So no, really, really good information because I think you're absolutely right. I think a lot of people just think, oh, I limit the sodium, which means I shouldn't put salt on my food. But what food are you putting that salt or not putting that salt on is really, really the most important part there, because the sodium is already there.
Right.
But without reading those labels, you just don't see it there.
And why do we need to limit the sodium is a question I also get. And it's because sodium retains water. It retains fluid in the body. And the more fluid that you're retaining, the higher your blood pressure is going to be. So there's a direct relationship between sodium and fluid. And if you're adding excess sodium, you're going to retain more fluid, and the higher your blood pressure will appear. So for the people that do not like to take medications, you know, this is one thing that you can incorporate in your lifestyle that may help to lower your blood pressure without actually having to take blood pressure medication.
Gotcha. And now, of course, some of the other bad ones on there is, the greasy foods, processed foods, but smoking and alcohol. I would assume that probably has a lot to do with maybe your hypertensions and even your risk for cancers, correct?
That's correct. So smoking nicotine is a carcinogenic, as well as alcohol. And so for people that have smoked for years regularly and drink alcohol on a regular basis, they have a much higher risk for developing some type of cancer, whether it runs in their family or not. And so with smoking, you see a lot of lung cancers, but you also see other type of cancers, you know, that can be associated with smoking. So, you know, this is a fix that is necessary. If you want to avoid cancer and the treatment and the sickness that goes along with it, start tapering back on the cigarettes now. You know, seek medical assistance for smoking cessation. And the same for alcohol. You know, reduce the amount that you're consuming, you know, until you've tapered back to where you're not drinking at all. These are some things that you can do to really reduce your risk of developing some type of cancer. As for the hyperlipidemia or the dyslipidemia, which is high cholesterol, number one thing, avoid fried and greasy foods. And I'm still surprised at this day and age, so many people still eat fried chicken 3 and 4 times a week. And, you know, most people love and enjoy chicken. There's other ways to enjoy it other than fried, boiled, baked, broiled, grilled. We have these air fryers now that do a great job without deep frying your food. So there's other options where you can enjoy your chicken, and there's ways to bake it where it will come out crispy. You know, there's some really good recipes out there. So I really try to encourage my patients, you know, to make a true lifestyle change by incorporating some of these cooking techniques into their daily routine to eliminate deep frying things, because that just clogs the arteries. Over time, it clogs the arteries. And so for the cholesterol, we recommend limiting sugars and avoiding fried, greasy foods. For diabetics, number one thing is avoid simple sugars. What are simple sugars, you ask? That is food that has zero nutritional value and are just sugary. So that's your sugary drinks, your sodas, your Kool-Aid, your lemonade, your sweet teas. It's no nutritional value in that whatsoever. And with the sodas, you got the sodium too. So it's kind of a double whammy. And you're not getting any benefit to your health from it whatsoever. So these are things we encourage you just eliminate from your diet. Simple sugars also includes cookies, cakes, pies, candy. No nutritional value in that. It's just a sugary based type of food that provides absolutely no benefit. And so for diabetics, it's vital that you eliminate that stuff from your diet. It shoots your blood sugars up to dangerously high levels, and it also can clog your arteries. And clogging arteries decreases blood flow to your vital organs. And these are things that heart attacks and strokes are made from.
Gotcha. Yeah. So,
Yes.
so cut all the fun stuff, but obviously just excellent advice there. You know, the point you made about deep frying versus the air fryer. I absolutely love the air fryer.
Yes.
And it kind of makes you think even Thanksgiving, you know, here in the South, a lot of people like to do fried turkeys, or
Yeah.
even I've deep fried stuff, you know, before, but take a look to see the level of the oil when you start and the level of the oil when you finish, and where did it go? Went right into what you're cooking, which makes it great, but then that's a heck of a lot of oil there. So,
And it's really
yeah.
interesting that you mentioned frying the turkey, because typically we fry turkeys in peanut oil.
Mm-hmm.
That's one of the worst oils you can use.
Yeah, of course.
It's one of the worst. It's on that avoid list.
Yeah, I got you.
Yes.
So moving on to kind of the third point there, and this actually involves adding something rather than taking away something, and that is adding more foods high in fiber. Could you elaborate more on foods that are high in fiber?
Yes,
Why that's
high
important?
fiber foods provide so many benefits for our bodies. So one benefit of high fiber food is it lowers your LDL cholesterol, which is what we call the bad cholesterol. We want that number lower, and it should be less than 100 for most individuals. For people who are diabetic, your LDL cholesterol should be less than 70. So it's a tighter scale for diabetics there. So diabetics should engage in really high fiber diet, and foods that are high in fiber are your dry beans, your green leafy fruits and vegetables, oatmeal, any type of legumes. And those are really good at getting that LDL down. And it also helps to increase your HDL, which is your good cholesterol. So it's really important for a high fiber diet for diabetics and for people with high cholesterol.
Yeah. Also, usually more filling too. So, you know, the more you replace with high fiber, you find you're not quite as hungry anymore. So good to know on that. The fourth point I thought was really, really interesting. This is, you know, the simple advice is checking blood pressure, checking your glucose levels on a daily basis, but more importantly, tracking that and bringing that record to your healthcare provider so the two of you can work together on what's working, what's not. I really thought that was an interesting point.
It's really, really vital for those people who have hypertension and diabetes type 2, because that way their prescriber can see exactly what their numbers have been reading over that 90 or 180-day period since they were last seen at the office. This gives, you know, the prescriber a really good indication of whether the medication is working ideally or if it needs to be adjusted or not. You know, if someone comes in and, you know, for their 6-month checkup and they're asked, how has your blood pressure been? And they say, oh, it's been really good. But if you look at that blood pressure log, you can see that they've, you know, were running 140s over 80s, and then they increased to 150s over 90s, and then they've increased to like 160s. That's a trend that your blood pressure is going up. And so it's a cue for the provider to dig a little deeper and find out, were you consistently taking your medicine? Were there any significant dietary changes such as sodium? And to figure out if we need to increase the dosage of your blood pressure medicine, or do we need to add another agent? And it's also important to look at these blood pressure logs, because depends on how your blood pressure appears, it it tells the provider what type of medication would work best for you.
Mhm.
It's real important to keep these logs and bring them in for review. And the nice thing about it now is technology has worked with us, and there's so many different apps that can track it for you. So you don't have to, literally like write it down and keep it in a
Yeah.
book and bring it in. There's apps that can keep these for you. There's these Fitbit watches and things, Apple watches that do that for you as well. So it's not as burdensome,
Mhm.
and it's not so much of a chore to have to keep up with that, because we've got technology that can keep up with that for you. For the diabetic, the glucometers that they use can track your blood sugar readings. And so now, Andy, a lot of patients just bring their glucometer in. It's a
Mhm.
small device, and we just go back and review the readings in there, and they don't have to write it down, keep a book of it or a notebook and bring it in. It's stored in the glucometer, so that's really nice too. But plus, they can utilize these apps that can track their blood sugar and blood pressure for them, because unfortunately, many people have both conditions.
Mhm. Yeah, and it's good to have those. I envision just trying to log and write something down on a notepad. You probably do that good for a little while, but then it starts
Right,
to trail out. So having some
that's
apps and
correct.
things, and I've noticed even in my world of health insurance, a lot of health insurance plans, obviously it's in their best interest to keep costs down, try to keep you in a healthier situation. And to do that would be to provide the tools and the ways that people can more maintain their health rather than put themselves in a situation where it gets worse from there. So really, really good point on that one.
Mm-hmm.
And then the fifth big one there is something we haven't covered yet. That is exercise, big E. And you are emphasizing low impact aerobic activities at least 5 days out of the week.
That's
Which I
correct.
thought was interesting.
5 days a week, 30 minutes duration each time.
Mm-hmm.
We're not stressing to do an hour workout, because that may be too much, but we need consistent aerobic exercise. And aerobic has so many cardiovascular benefits, and that's why we stress aerobic exercise. That's your walking, jogging, which I don't recommend, but walking, jogging, cycling, whether it's a stationary bike or you're getting out riding through the neighborhood, Pilates, things of this nature are typically low impact, and they provide a good cardiovascular benefit if you have a consistent 30-minute duration. We stress low impact because one of the worst things that can occur is an injury. And when an injury occurs, then you become even more stationary and more sedentary, and it complicates the already chronic medical conditions that you already have.
Yeah.
So the main thing is to avoid injury, so you don't end up being on bed rest or having to sit with your leg elevated because you have a severely sprained ankle. And sedentary lifestyle causes a multitude of problems, including development of blood clots, things like constipation, bowel blockage. Our bodies are designed to walk. And so we don't want to do anything that's going to hinder us from walking, because walking provides so many natural benefits for our body. So it's really important to avoid injury at all costs.
Yep. The body is made to move. I've heard that many, many
That's
times.
correct.
It's
Yes.
So I mean, those kind of being our big 5 tips. I think a lot of people will think, oh, of course, duh. We've heard all that before, but it's really important to go over them again. I had a thought about this, about this conversation, and that, as people, it's human nature to do this stuff, but we take the time to recognize something's going on, to set an appointment with our healthcare provider, to take time out of our day, maybe even paying a fee or a copay. We go pick up medications. We do all this stuff on the front end, and yet so many people find ways to avoid or get around these 5 main drivers to helping their condition overall. I don't know if that's been your experience, but that's just kind of what I see. It's just
very
really funny
common.
to think about that way. But
Yes, it's very, very common. And for the ones that do adopt these lifestyle changes, and I do call them lifestyle changes because they need to be a permanent part of your life. The ones that do adopt this, they feel significantly better, significantly better. And some of the comments I receive are, I didn't realize how crummy I felt until I started doing this and felt better.
yeah,
So these are good things to incorporate, even for people who aren't age 65 and older. It's great prevention tips, because if you incorporate this earlier in life, you may avoid hypertension and diabetes and high cholesterol and cancer. Limit your processed foods because, like we said, they're high in sodium.
mm-hmm.
So I just strongly encourage everybody to just take a quick assessment, of their lifestyle and see how they can incorporate these tips in there, to live healthier and happier.
Yeah, that is terrific. I really appreciate it, Michelle. We'll probably wind it down from here, but definitely, appreciate your willingness to come on and talk with me about this. I think it's going to do a lot especially for the people that I work with and hopefully the ones that are watching this channel right now. So we can go ahead and sign up from here. But this is, I'm Andy Stanson with Stanson Health and Life. And my guest today has been Michelle Scott with Ready Health and Wellness here in Jacksonville. And we'll put some contact information out there. But most importantly, follow these 5 tips. Take your medications as prescribed. Limit sodium, sugary foods, fried, greasy foods, smoking and alcohol. Consume foods that are higher in fiber. Check your blood pressure or glucose on a regular basis and track that, and then find ways to share that tracking with your healthcare provider. And then engage in low impact aerobic activities at least 5 days a week. So just really appreciate your time, Michelle, and I hope to talk to you soon.
All right. Thank you for having me. It was my pleasure.
Thanks. See you later.